a minute or two to let people file in before we get underway. But if you are here for FMEP's webinar talking about COVID vaccines for Palestinians, you are in the right spot. Don't go anywhere. We will get started shortly. Just going to give this another minute before we get going. And sorry, we're trying to make sure this is on Facebook Live before we get going. Well, my colleagues will sort that out because I think we shall start. So good morning, everyone, and welcome. My name is Kristen McCarthy. I am FMEP's Director of Grants and Operations, and I'll be the moderator for today's conversation. So I want to thank everyone so much for joining us today to discuss exactly what's happening in Palestine with regards to COVID vaccinations and the role the state of Israel is playing or refusing to play in that process. Just for context, if you've read any of the headlines this week about the state of COVID in the West Bank and Gaza, you know that the outlook is grim. Gaza is experiencing a new surge in cases and hospitalizations, and the West Bank hospitals remain at full capacity. Meanwhile, Israel is thought to be close to reaching herd immunity thanks to its highly successful vaccination program, which has been praised worldwide. I feel like every time I turn on NPR and they have a segment on COVID, they talk about Israel as a shining example of how to do this, how to vaccinate. So, but while what those giving accolades to Israel fail to mention is that there's a huge asterisk on Israel's vaccination drive, which is that Israel is refusing responsibility for vaccinating more than 4 million Palestinians living under its control in the West Bank and Gaza. While every citizen, including settlers living in the West Bank and Palestinians living in East Jerusalem with permanent residency, are able to receive the vaccine, Israel has not only refused its legal responsibility for vaccinating Palestinians living under occupation, Israel has also not meaningfully helped Palestinians run their own vaccination effort. That has left the PA and Hamas to turn to foreign governments to secure just a small number of vaccines. So to discuss all of these issues and more, I'm delighted to be joined by two experts who I will introduce here very briefly. Their full bios are on our website at fmep.org, and I think there'll be a link to that put in the chat. Please keep your eye on the chat for more resources. First, we have Yara Asi, who is a postdoctoral scholar at the University of Central Florida. She is a 2020-2021 Fulbright U.S. Scholar to the West Bank, a policy member of Al-Shabaka, and a non-resident fellow at the Arab Center, Washington, D.C. We also have Ghada Majadli, who is the director of the Occupied Palestinian Territory Department at Physicians for Human Rights Israel. Ghada holds an MA in Human Rights and Transitional Justice from the Hebrew University of Jerusalem and a bachelor's degree in social work from Tel Aviv University. A few of our regular housekeeping notes before we get going. The format for today's webinar is a discussion between the panelists and myself. We'll go for about an hour and 15. We are being recorded and hopefully it's live on Facebook. Greetings to Facebook if you're there. In addition to my own questions, we are always happy to have questions from the audience. Please use the Q&A box. You can find that at the bottom of your screen. Please do not use the chat box. Chat box is only for technical difficulties if you're having any problems with the webinar, and for you to keep your eye on. As I said earlier, my colleague Sarah Ann will be putting a ton of links to resources and how to follow our panelists and all that good stuff in the in the chat box. If you miss anything in the chat box, do not worry. We will post all of those resources along with the recording of this video on our website later, and we're going to email it out to all of you. And finally, please note that we have enabled the closed captioning function for those who prefer to read rather than listen. If you have any trouble with the closed captioning or need help, please just write to us in the chat box. And with that, let's go. We're going to start with Ghada. And I think what's important is that before we start talking about vaccines, I want to get a sense of what's actually happening with COVID. So Will you paint a general overview for us of how the COVID pandemic is currently being experienced in Israel as compared to the West Bank and Gaza?
Yeah. Okay. First, I want to thank you, Kristen, and the Foundation for Middle East Peace for initiating this discussion, very important discussion. And I'm happy to be here today with you and with Yara. And regarding the situation in Israel, so Israel is almost going back to normalcy gradually after its national vaccine campaign that proved and demonstrated high effectiveness. More than 52% of the population in Israel is fully vaccinated with the 2 doses. And the percent of positive test is 1.1, which is very low compared to the Gaza Strip and the West Bank, but especially in the Gaza Strip now with the fact that 44% of tests are positive. And we are witnessing a significant decrease in daily new cases. In the past couple of days, the daily new cases were 100, 130. And this, of course, allowed the gradual reopening of Israel's economy and commercial. For example, bars, restaurants, gyms, and even the Israeli airport, the Ben Gurion airport is open now, and there has been more, like easiness on the restrictions. In terms of school and kindergartens, they are also open partially. Now, vaccine-wise, the media has reported that Israel has intention to obtain more Pfizer vaccines. We're talking about millions of the Pfizer vaccines, alongside 17 million doses of Moderna and the AstraZeneca vaccines that Israel purchased at the beginning of the campaign and did not use at all. And it seems also that Israel is going for securing more doses to pregnant women, children above 12, and other categories. And Israel also wishes to secure more doses in case people needed to be vaccinated more than once a year. As well, media has reported on vaccines waste, as Israel has purchased more doses than it needs. But I think that the most important thing to emphasize and note is the problematic aspects of Israel's national vaccine campaign and their agreement with the Pfizer company, as Israel has become a real-time laboratory for the Pfizer company. And although the Minister of Health tried repeatedly to avoid answering these questions, it seems that the Pfizer company will be securing all vaccines for Israel in exchange for data regarding the effectiveness of the vaccine. And some media reported also that medical information of Israeli citizens will be transferred to the Pfizer company. Israel also agreed on a joint study with the Pfizer company, and all these issues raised a troubling ethical and legal questions and a public debate in Israel, especially that many of Israelis have linked the elections and the charges against Netanyahu and to his great efforts to secure vaccines, that Israel also has paid double the market price. So this is generally the situation in Israel.
Thank you. You definitely covered a lot of ground in that. I mean, there's, like you said, there's just so many different angles to Israel's own vaccination program. So Yara, I want to turn to you now to add to that picture. Specifically, try to give us a sense of what's happening in the West Bank and Gaza, and what the underlying disparities are there, specifically with regards to how COVID is being experienced right now.
Yeah, well, of course, first off, thanks for having us here, Rada. Great to meet you. Um, Building off what Rada was saying, I think it's first important to very briefly illustrate the disparities before the pandemic to get that context to understand what's happening today and kind of why it's happening. Prior to the pandemic, the average life expectancy of a Palestinian was 10 years less than that of an Israeli. And that includes settlers in the West Bank, who, of course, are living on the same land as Palestinians, and significantly higher maternal mortality, infant mortality. And these are kind of basic indicators for the functioning of a health system. So just looking at them base level, the Palestinian health system was really deficient. Even Palestinian citizens of Israel experience worse health outcomes than their Jewish Israeli neighbors. So this tells us it's not a matter of resources, it's about equity of distribution of these resources. Palestinians have fewer hospitals, they have fewer ICU beds, they had fewer ventilators, they have, of course, significantly fewer vaccines, and they're basically at a deficit on any measure you could think of in terms of social support. So as of today, I checked this morning, active cases are near their peak level for the entire past year at just under 30,000 active cases. There have been a total of about 3,000 deaths. Luckily, most cases have been with younger populations, so that's undoubtedly kind of spared some of the higher mortality rate. We're seeing case positivity rates, as was just noted, of upwards of 40% in recent testing in the Gaza Strip. In the West Bank, ICU capacity is at 100%. There have been new lockdowns, new curfews, new closures to travel between the main areas and the villages. All gatherings, including weddings, funerals, have been banned again. And troubling is we've seen the B117 UK variant, which is thought to be much more contagious, and that's driving the most recent cases in both territories. So to me, that's really worrying. But you have an economy that's been struggling for decades and under various forms of COVID lockdown for a year. And people are really desperate to get back to work and get back into society. The World Bank predicted a dip of up to 35% of Palestinian GDP just in a year due to COVID. So I don't think we're going to be able to go back to the same levels of compliance for masking and social distancing that we saw at the beginning of the pandemic. With just over 5% of Palestinians vaccinated so far, basically every indicator seems to be heading in the wrong direction. And so at the same time, talking about disparities, you have upwards of 60% of Israelis that have received at least one shot, more than half are fully vaccinated. So literally on the other side of the wall, you have a country that's reopening gyms and bars and concert halls, while the situation in the West Bank and Gaza is literally the worst it's been since the pandemic started.
Thank you. Yeah, I want to stick with you because I want to go straight into what the Israeli government's position has been on vaccinating Palestinians living in the occupied territories. If you can just contrast what their response and posture has been on that to what their duties and obligations are under international law, that would be terrific.
Yeah, well, it's important to note that, of course, COVID is not the first instance where Israel has not fulfilled its legal obligations, but we'll get into that. Israel's position essentially is that Palestine is just another autonomous neighboring state, that the PA is solely responsible for Palestinian vaccination, and that any support Israel provides is charity or humanitarian need, and it's not due to any Israeli legal obligation or anything like that. It's just the same as them providing vaccines to any other poor country. I think this position was laid out pretty plainly towards the beginning of the pandemic, when the Israeli health minister said, and I'm quoting, If it's the responsibility of the Israeli health minister to take care of the Palestinians, what exactly is the responsibility of the Palestinian health minister to take care of the dolphins in the Mediterranean? Unquote. So let's remember that at the same time, Israel is arguing that the International Criminal Court, the ICC, can't take up the Palestinian case in part because Palestine is not a sovereign state. So this vaccination issue is one of those instances where Israel is choosing to exercise maximum control over Palestinians, yet take minimal responsibility for their well-being. Fortunately, international law is quite clear on this. It's important to emphasize that Palestine was recognized only as a non-member observer state by the UN in 2012. It does not have an autonomous government. It does not have control of its borders. Israel controls all movement of Palestinian goods and people. Despite statements by some Israeli ministers and legal scholars, every international body continues to recognize Israel as the occupying power, including Israel's own Supreme Court in the West Bank and East Jerusalem and the Gaza Strip since 1967. So in that occupying power framework, the Fourth Geneva Convention mandates many responsibilities for an occupying power towards an occupied population. And, typically when you think of a military occupation, this is a short-term kind of emergency last-ditch period. This is not meant to last decades and decades. So it is a burdensome commitment to care for an occupied territory's public health, their hygiene, their medical supplies, food, water, etc. These duties, according to the Geneva Conventions, are not displaced by humanitarian aid. So, for example, donations of vaccines that Palestinians get does not displace Israel's responsibility. And perhaps most importantly, no agreement between the occupied and the occupying power removes these protections. So many that are arguing, and this is what I think most of us in this call and that are probably listening have heard, is that Israel no longer has this duty towards Palestinian health because of the Oslo Accords. It's important to remember that the Oslo Accords, which were signed in the mid-1990s, was an interim agreement. It was meant to lead to some final status negotiation by the year 2000. So aside from the fact that Geneva itself dictates that no agreement supersedes the conventions, and the fact that the Oslo Accords themselves were written as an interim agreement, even if we were to accept all of those premises, the Oslo Accords themselves lay out what the Palestinian Authority's responsibilities are, specifically with regard to vaccinations. They include hepatitis B, polio, many of the vaccines that all of us, around the world receive as children. Regarding contagious diseases, the Oslo Accords actually stipulates anyway that the two sides must cooperate and coordinate. And lastly, I have to point out that the sudden defense of the sanctity of Oslo and of Palestinian sovereignty, it just seems very convenient to point it out now in this pandemic, considering very few of these same entities have ever noted or advocated for the multiple other provisions of Oslo that were never enforced, that were meant to give Palestinians autonomy. So to now say in this pandemic that after decades of stifling the Palestinian economy and health system, Palestinians have to procure their own vaccines, I just think it's wrong on a legal level, of course, but also pragmatically and morally.
Thank you. Yeah. I have another question for you on the Oslo legacy, but I think we'll get to that in later rounds.
Sure.
Coming to you, Ghada, Yara has raised the Israeli Supreme Court. So I want to come to you on that topic as well, because I know that the Physicians for Human Rights and a coalition of other Israeli and Palestinian NGOs recently submitted a petition to the Israeli Supreme Court, asking it to essentially force the government, if I'm understanding it right, to vaccinate all Palestinians living in the occupied territories. So can you explain to us what this case is about, what its legal arguments are, and then just can you give us an update on where it stands and how you see it proceeding?
Yeah. So as you said, the petition was led by Physicians for Human Rights Israel together with 5 Israeli and Palestinian human rights organizations. And we addressed in the petition 3 main arguments. The first one was the legal one regarding Israel's obligations. And I think that Yara just did a terrific introduction, so I won't be delving into the details of the legal arguments. It was basically based on the international law and Israel's obligations as an occupying power. Also, it was based on the Supreme Court, the Israeli Supreme Court precedents, and it addressed the extent of control that Israel has on Palestinian life and space, and the fact that Israel controls passage and movement of Palestinians, borders, social determinants of health, and the Palestinian economy. And it was a control which hugely impacted and harmed the state of health in the occupied territory. And we also addressed the epidemiological argument. The petition actually emphasized that Israel has a legal, a moral, and an ethical obligation towards the Palestinians. And it derives from its occupation and ongoing control of the Gaza Strip and the West Bank for decades. As I said, it was also supported by international law and Israeli court precedents. The petition also focused on the state of health in the occupied territory, the economic system, and it argues that these have been subjected for many years to restrictions imposed by Israel and were affected by Israel's control. For example, restrictions on movement and passage of medical teams that Israel has been imposed for decades now, and it resulted in the unavailability of medical expertise in the West Bank and in the Gaza Strip. For example, oncology physicians, and also it addresses the fragmentation of the Palestinian territory in the West Bank, the Gaza Strip, and East Jerusalem, which also resulted in fragmentation in the health system, which has hugely also impacted the ability of the healthcare system in Palestine to function as a single unit. In addition to many other practices and restrictions that brought to the de-development of the healthcare system in Palestine for decades. And all of these practices and this situation and the dire conditions in which the fragmented Palestinian health system has been functioning for decades now made it also impossible for the PA and for the health system, the Palestinian health system, to deal with the COVID-19 pandemic properly and independently without the support of the international community and other donors and states. And we also reminded the court that, as Yara said also, that the Oslo Accords do not displace the Fourth Geneva Convention and Israel's responsibilities and duties as an occupying power. And for the epidemiological argument, it was also backed by a professional opinion by the Israeli Association of Public Health Physicians and the Israeli Medical Association. And they have been calling actually for months now for Israel to vaccinate Palestinians, because they understand that for herd immunity, the whole area between the Jordanian River and the Mediterranean Sea is a single epidemiological unit for herd immunity. And because they also acknowledge that for herd immunity, the whole Palestinian population should be vaccinated immediately, as well as we address in the epidemiological argument the fact that there is a constant movement between the Palestinian territory, whether the Gaza Strip, the West Bank, or East Jerusalem, and Israel. For example, the Palestinian workers, and we saw that Israel vaccinated in a huge delay Palestinian workers, and we can also talk about this later. As well as settlers, Jewish settlers in the West Bank, Palestinian workers in settlements, patients from the Gaza Strip who are doing their journeys to Palestinian hospitals in the West Bank and in East Jerusalem. So if Israel actually wishes to isolate Palestinians, to not take responsibility for their health and for providing them with vaccines, it is difficult to do so. But we can also, I think, later talk about these wishes and Israel's conduct in terms of isolating Palestinians in the Palestinian territory.
Thank you. So can you just give us an update on, are there important court dates coming up, or where is this petition in the court system?
Yeah, so the only decision that has been made is that the state should be providing and submitting the response by the 13th of April. And I also want to say that a statement of support has been circulated among health professionals, human rights, and legal professionals in support of the statement and the petition. And I will be also sending the link in the chat for those of you who are listening to us today. If you are health professionals, human rights and legal professionals, it would be very beneficial if you also sign the petition, sign the statement in support.
Great, thank you. Yes, please share that link. So I want to actually stick with you, Ghada, switching gears a little bit. So I want to know what, if anything, Israel has done for Palestinians in the West Bank, right? Because it's not that Israel hasn't done anything. They've given they've made very targeted interventions to vaccinate Palestinian workers who cross into Israel and Palestinians who work in the settlements. So will you explain to us more about these sort of interventions and Israel's activities to vaccinate Palestinians in the West Bank?
Yeah, okay. If we examine the map of Israel's interventions to vaccinate Palestinians, we see that Israel vaccinated only Palestinian workers, as I said, with a huge delay. In addition to another 5,000 Moderna vaccines to medical staff in the West Bank. And I remind those of you who are familiar with the situation in the West Bank, as Ziara said, about the dire condition in the West Bank and the fact that we have estimated 20,000 medical staff in the West Bank, and the fact that Israel sent 5,000 Moderna vaccines, it's enough only for 2,500 persons. So it is almost nothing in terms of assistance. And if we're also examining Israel's extent of control in the Palestinian territory. Now, when the Israeli Ministry of Health decided to vaccinate all statusless persons in Israel, regardless of their nationality, they explicitly excluded the Palestinians. They had this, sentence at the, bottom of the page saying that this decision is not applied to Palestinians in Israel, whether they have a permit or they are statusless persons. And also they said that this decision also does not apply to Palestinian workers. Later on, after pressure mainly of human rights organizations, they say that they have another plan for Palestinian workers. Up until this moment, the Israeli Ministry of Health have not yet declared that it is in their intention to vaccinate statusless Palestinians and Palestinians with permits. And we're talking about almost 10,000 Palestinians living in Israel, whether with a permit or without a permit. In fact, PHRI is likely to petition the High Court to revise this inhuman decision. And this might be happening in the next couple of weeks. Now, on the one hand, we can argue that Israel vaccinated Palestinians out of utilitarian motives. They have vaccinated almost 100,000 workers. As you know, it makes a sense in terms of the epidemiological, sense. But on the other hand, Israel's refusal to vaccinate some 10,000 Palestinians living in Israel, which also can, affect the herd immunity. It has the potential to refute this argument that Israel will and should vaccinate Palestinian for its own interest, which means that it is likely that Israel vaccinated Palestinian workers as they are the backbone of Israel's economy, and that the decision not to vaccinate them can harm actually Israeli employers. Namely, Israel has given very little to the West Bank, and for Gaza, not only that they did not assist, and when I say assist, it's not assistance because it's Israel's duty and responsibility, but also the Israeli Knesset 2 months ago debated whether Israel should allow the transfer of vaccines from Ramallah and other countries to the Gaza Strip. And also relating to what Yara said about the contradictions in Israel stand on the Oslo Accords, in this discussion in the Knesset, on the one hand, the Israeli Ministry of Health was stressing and saying that it is not Israel's responsibility to vaccinate Palestinians, as health and other civil areas are under the PA responsibility and control. But in the same room, a discussion regarding whether to allow the transfer of vaccines to Palestinians in the Gaza Strip, was present. So I think this contradiction is also seen within Israel, within different government offices, and within the public.
Yeah, we'll come back. I'm going to ask you more about Gaza in just a second.
I just want to say the final sentence. I think that, from Israel's conduct and, especially that avoiding vaccinating Palestinians makes no sense epidemiologically. It seems that Israel, as I said earlier, wishes to isolate Palestinians in the Gaza Strip and in the West Bank for some extent. And I think that they have good experience with the siege in the Gaza Strip for the previous years, in order not to bear the economic burden, and most importantly, acknowledge their responsibility for the health of Palestinians.
Yeah, thank you. I find the self-interest argument for why Israel should be vaccinating Palestinians a difficult one to hear repeatedly, that it's in Israel's interest to do this. It's not just that, it's Israel's legal obligation. So Yara, coming to you to kind of add to what Ghada laid out on West Bank Palestinians, and to clarify for us what's happening specifically for Palestinians living in East Jerusalem, who are residents of Israel, permanent residents of Israel. So can you tell us what's happening there?
Sure. So as you know, most Palestinians living in East Jerusalem are permanent residents of Israel, although we are seeing increased rates of these Palestinians applying for Israeli citizenship because being with permanent resident status, if you leave the territory for too long, you can have difficulties coming back. You can lose access to your land. It's just a very strange setting of governance limbo. So East Jerusalem has been underserved historically. I mean, even on matters as small as trash collection, for example, the PA, Israel does not permit the PA to really function there. So when Israel opened its vaccination rollout, they did set up vaccination centers in East Jerusalem because they do count East Jerusalemites as their population. They by Israel's own claims, they have annexed East Jerusalem, even though the international community does not recognize this. So since the beginning of the pandemic, human rights activists and groups have been kind of really worried about the situation in East Jerusalem because there were initial Palestinians tried to put up checkpoints to prevent movement. They tried to put up clinics. Israel took down the checkpoints. They arrested Palestinian organizers who were trying to, put forth information about COVID. They initially did not release COVID-related information in Arabic and Hebrew, only in Hebrew. And maybe one of the links we could drop in the chat, there was a report by the Palestinian NGO Al-Haq from, I think, June or July, that looked specifically at the issue of how East Jerusalem was being left behind in COVID. So they pointed out lack of testing facilities, inaccurate and unreliable data, harassment and arrest of Palestinian health activists who tried to, put out information, build clinics. The fact that their hospitals in East Jerusalem, the Palestinian hospitals, are the best Palestinian hospitals that Palestinians can access outside of going to Israel or Jordan or Egypt. But the hospitals were nearing a breaking point. You started to see ICU beds filling very quickly. And then just the general tangle of Israeli bureaucracy, militarism in this region is quite high. There are countless reports coming out of this very tiny territory. I mean, I encourage your viewers to look at a map of East Jerusalem, and yet it has almost as many COVID cases as much bigger parts of the West Bank, like the Ramallah area, the Nablus area. In East Jerusalem, cases are very high, as I stated. Israel, thus, they did roll out the vaccination effort, but you saw a much slower rate of vaccination. So initially this was blamed on lack of information, as I said, but also vaccine hesitancy. And now I think as March kind of, rolls into April and more people are seeing other people get vaccinated, we're seeing rates of vaccination in East Jerusalem, and especially in certain pockets, really increasing. So the hope is that it will take kind of the opposite trajectory of the rest of the West Bank as more vaccinations come out. And at this point, so many people living there have been infected already. There's really only, it can only go up at this point, we hope.
We hope, indeed. All right, Ghada, we need to hear about Gaza. So will you tell us what's happening in Gaza? We know that Gaza is entering a new wave of outbreak. 25, I think Yara said almost 40% positivity tests coming back positive. So will you tell us what's happening in Gaza with vaccines?
Yeah. So the percent and the rate of positive test is 44 now in the Gaza Strip, and they're actually witnessing second wave, and it is more harsh than previous wave, and we are hearing about a large number of infections, and the situation, is bad in terms of closures and movement restrictions on movement. Universities are closed again. And in terms of vaccines, the Ministry of Health in the Gaza Strip has received a total of almost 90,000, maybe some more, vaccines. The majority of them are the Sputnik vaccine, the Russian one, some Chinese vaccines, in addition to vaccines secured through COVAX, the AstraZeneca and the Pfizer vaccines. And as published by the Ministry of Health, they are planning actually to vaccinate 1.2 million people in the Gaza Strip with priority for health workers, elderly above 60, and people with chronic diseases. And the vaccines that are available now in Gaza are enough to vaccinate only 2.5% of the population. And I think what is important to actually note and address when we're talking about the situation in the Gaza Strip is not only a situation in terms of vaccinations and how many vaccines have arrived or how many has been vaccinated, but also to talk about how the coronavirus and the fact that there is still no public campaign to vaccinate Palestinians in the Gaza Strip is affecting mainly patients in Gaza and their access to medical care, since the situation in terms of the health state has been, difficult even before the pandemic. The healthcare system in Gaza has been struggling to meet the needs of the population even before the pandemic, mainly because of the Israeli closure and restrictions on the passage of patients, of medical devices, and some of the materials needed are listed as dual use. So Israel does not allow the entrance of these materials, which means that as long as there are no enough vaccines to vaccinate the whole population in the Gaza Strip, the healthcare system will continue to be burdened with challenges. And since the beginning of the pandemic, Israel has been increasingly restricting the movement of patients from the Gaza Strip to hospitals, Palestinian hospitals in the West Bank and in East Jerusalem, and it is allowing only life-saving treatments. So if you want to obtain the permit, it is allowed only for patients who need a life-saving treatment, such as cancer patients, while the need is still the same need in the Gaza Strip. All of these unavailable treatments in the Gaza Strip before the pandemic are still unavailable, which means that many patients in the Gaza Strip now have no access to medical care since the beginning of the pandemic.
Great, thank you. And if time allows, I'm going to come back for another round of Gaza questions because it's important to know what's happening. So Yara, I want to ask you briefly to just respond. I feel like there's been a fair amount of Israel patting itself on the back over these very limited interventions for workers, for Gaza traders, for these very small programs that I think were perfectly laid out by yourself and Ghada. So how do you respond to this? What do you say to people who defend Israel's actions by pointing to these small interventions? And given that Israel is reported to have a surplus of vaccines, which was mentioned earlier, that it could be sending to Palestinians, can you get, why aren't they doing more?
Oh, there's so much there. And, I've also heard, like we were discussing earlier, that they are being kind of defended because they're vaccinating Palestinian citizens of Israel. So I think it's a pretty low bar to brag that one of the most highly developed countries in the world is making vaccines available to a minority population of its own citizens. Israeli citizens are Israeli citizens, regardless of race or religion. So, they certainly should receive the same benefit any other citizen of that state would receive. They pay taxes, they vote in elections, they should get vaccinations. So I don't really see that as the sort of defense I think some people seem to think it is. The counter argument, of course, is that Israel has a case to not vaccinate its own Arab citizens. So the situation to me in East Jerusalem is similar. By Israel's own account, they annexed East Jerusalem, even though the international community still views it as occupied. The Palestinians that live there are Israeli residents. That Israel doesn't allow the PA to do anything there. So there's not even a pretense that Israel is not responsible for the people that live there. But as you note in your question, things get a little more complicated when we talk about the other populations of Palestinians Israel has vaccinated. But I think it's important to remember that none of these small interventions seem to stem organically from Israeli policy. They all came after massive pressure and condemnation. So, for example, first, there was the issue of Palestinian prisoners in Israeli jails. I mean, is there any more acute example of a person being subject to a state than being jailed in, an incarceration facility? They had to be petitioned and pressured to do so. And again, you can argue that this was in their best interest because Palestinian prisoners interact with Israeli prisoners, interact with Israeli prison guards. There were many cases of prisoners and guards that had COVID early in the pandemic. So, that seems again to just kind of make sense. I don't see that as any benevolent action. Then in March, months after Israel started its own vaccination campaign, nearly a year after the first Palestinian workers from Israel started bringing COVID back to the West Bank, then they agreed to vaccinate the Palestinian workers. Again, this was not some pre-established stance that they said, "Oh, we've always planned on doing this." This was after months of pressure and condemnation. And again, you can argue that this was in Israel's best interest because these Palestinians go in and out of Israel every day. As Ghada said, Israel's construction sector is 75% Palestinian. So if you start seeing massive outbreaks in this population, Israel's construction sector kind of shuts down. So with regards to the Palestinians in the occupied territories, Israel pledged a 5,000 vaccine donation, but for my information, and maybe Ghada, you have more updated numbers, they've only delivered 2,000 so far. So we've heard the idea floated that Israel will donate its vaccine surplus once it finishes its mass citizen vaccination campaign. But there are recent reports that Israel has plenty of spare vaccines sitting in storage facilities. They have orders for tens of millions more. I assume this is for some booster program they intend to roll out in 6 months or so. And they're still not vaccinating Palestinians today. So as to your much more complex question as to why they're not doing more, Israel has never fulfilled its Geneva mandated responsibilities to Palestinians, in part because many Palestinians and influential figures, Israelis and politicians and influential Israeli figures and legal scholars, they simply refuse to acknowledge the occupation. And so if there's no occupation, then there's no legal responsibility. So it's very convenient to say, this land is disputed, but the PA is responsible for the people that live there. And when there's a two-state solution in, I don't know, a million years, then we can figure out some more of these questions. It's much easier to blame the PA. And I mean, let's be clear, I think the PA has handled this situation very poorly since the beginning. But again, they're not a true governance body of a sovereign state, so their hands are tied in many ways. And there's been a few cases where Israel outright blocked or rejected Palestinian requests for vaccines. There was a case when Palestinians asked for maybe 10,000 or so vaccines in the late fall for healthcare workers that was rejected. There was a recent case of a Palestinian student from Tel Aviv University who was told she'd be able to get a vaccine, drove the hours to the university, was turned away for several days until a global pressure campaign. They eventually vaccinated her. And then this example that Ghada brought up earlier, where the Israeli Knesset debated and in fact blocked for several days this shipment from one Palestinian entity to another Palestinian entity. So I don't even see how you could argue that Israel should have been involved in that process, except, of course, Israel has to approve any exports and imports from Palestinian lands. So they have taken every opportunity, I think, to do the bare minimum. Only when there has been an outcry from advocates, from public health professionals, from groups like PHR, have they moved forward on any of these initiatives. And with their election over, I thought maybe the vaccination of Palestinians might pick up. That doesn't seem to be the case. So they seem to be kind of embracing this viewpoint that there really is very little role for them here.
Thank you. You've telegraphed, I think, where I'm going next, which is to talk about the Palestinian Authority and what they have been able to accomplish under these conditions. So, without any systematic or significant Israeli intervention, the PA has been attempting to orchestrate its own vaccination drive. So, will you walk us through what and how the PA has been working? And I'm talking specifically about the PA and the West Bank. If you can add in Hamas, great. I know that's a lot to cover. So what have they been doing and where have they been getting these vaccines?
Sure. So I will try to minimize throwing numbers at your viewing audience, because I know that can kind of cause our eyes to glaze over. But, you know, when you look at the Israeli vaccinations, it's basically all Pfizer. They, like Ghada said, had this initial deal with Pfizer, paid a lot for it. So there's one kind of consistent vaccination drive in Israel. In the territories, in the Palestinian territories, the procurement process is extremely fragmented at best, just like basically anything else there. As of the latest data I could find released by the World Health Organization, the Palestinians have received just over 250,000 doses, and this excludes the 100,000 or so that Israel provided to Palestinians with Israeli work permits. In the West Bank, more than half of these vaccines are actually the Chinese vaccine. And then there's several tens of thousands from Pfizer and AstraZeneca, 8,000 from the Sputnik vaccine, and 2,000 of Moderna, which was that Israeli donation that we alluded to earlier. In Gaza, almost all of the vaccines are the Russian vaccine, primarily because of a significant donation from the United Arab Emirates. And then in Gaza, you have just over 10,000 each of AstraZeneca, Pfizer, and Sinopharm, which is the Chinese vaccine. So while the PA did buy some of these vaccines, they've spent tens of millions of dollars. Most are donations thus far from Russia, China, India, states in the Gulf, and they've started to receive some shipments through the World Health Organization's COVAX program, which is their vaccination program for low resource countries. So because the world's high-income countries are supporting COVAX, in essence, they're subsidizing the Israeli occupation by paying to vaccinate Palestinians instead of holding Israel to its legal responsibility to do so. The Palestinian Authority can't afford the rates that Israel or other high-income nations paid to these pharmaceutical companies. Rich nations globally have bought up 75% of existing vaccines. So you have dozens of low-income countries that are kind of fighting to get that 25%. I mean, in some regards, this is a supply issue. These pharmaceutical companies are trying to produce vaccine quickly, but with richer countries buying up huge shipments, it makes it really hard by the time it trickles down to these low resource countries. So since November or December, you've been hearing these constant reports from the PA about a small deal here or there in a very piecemeal way, very little transparency about how much they're spending, very little transparency about who they're allocating vaccines to. We heard some initial reports that initial shipments went to like the Palestinian soccer team, for example. And we have no idea how exactly they plan to get to this 75 or 80% of the population that needs to be vaccinated for herd immunity that would allow the territories to reopen in a meaningful way. So then just to end with Hamas, they have bought very few vaccines. Almost all of the vaccines in Gaza at the moment are donations. And again, no long-term plan. We don't know. It seems to me like they're kind of waiting this out, seeing who will have a surplus, who will donate. Many people have already been infected. So just by math, there's fewer people to get infected in the future, unless these variants kind of start giving us problems.
Great, thank you. Ghada, you see what's happening on the ground. So what's your assessment of the Palestinian Authority's campaign so far and its capability of obtaining and administering the vaccines? And if you can add what groups like PHRI, Physicians for Human Rights Israel, play in the vaccination effort. And also another question for you is just like, how are these vaccination drives working? Do people go into hospitals? Are there mobile clinics? Kind of, what does that look like practically?
Yeah, so every time I'm asked about the PA's ability to secure vaccines for the whole population, I refer them also to what happened since the beginning of the pandemic. I mean, if the PA has been calling since the beginning of the COVID-19 for support to secure basic supplies to combat the virus, such as test kits, gloves, masks, etc., hygiene material for hygiene measures, and the majority of these supplies were secured by the international community, the WHO, the UNICEF, and other donors, then I don't think that expecting the PA to be able to initiate a national campaign for vaccines and to be able to independently and without the intervention of Israel to do so is just unrealistic. The PA, as Yara also said, is not a sovereign state. They do not control borders. They do not control imports and exports. Even the vaccines that they have obtained, whether the Russian vaccine, the Chinese vaccines, or the COVAX, each and every vaccine, before it reached the Palestinian territory, whether the West Bank or the Gaza Strip, it has to be approved first by the Israeli Ministry of Health. And this is according to the Paris Agreement as part of the Oslo Accords. And it feels now like ages ago, but at the beginning of the Israeli national campaign to vaccinate Israelis, we have reached out to the Israeli Ministry of Health and to the coordinator of the government activities in the territory, and we asked whether the Russian vaccine will be allowed to the Palestinian territory. And we, of course, do not encourage or support the fact that Israel and the Israeli Ministry of Health should be allowing or not allowing the transfer of vaccines and drugs to the Palestinian territory. But it just, absurd that the Israeli Ministry of Health have insisted since the Oslo Accords to approve drugs and medicines to the Palestinian territory, and these drugs that weren't approved for Israeli citizens were not allowed to the Palestinian territory, and the PA, was forced actually to import drugs in high prices, such as prices that Israel can pay. And it is really absurd that Israel allowed the transfer or approved the Russian vaccine to the Palestinian territory because it was in their interest that the Palestinians receive the Russian vaccine, even if it's wasn't approved. So they don't, take responsibility over the supply of vaccines. So again, it is important to know that the Palestinian Authority doesn't have, the capacities. They don't control their economy in order to, be able to secure vaccines to the whole population. Now, when we talk about the role of organizations such as Physicians for Human Rights Israel, I think that the rule, I see it as a rule in two directions. The first one, that actually the two directions should be, complementing one another. The first one is to challenge Israel's policy and decisions, and the petition that we submitted to the High Court is one example. And when I say to challenge Israel's policy, I mean internally challenge Israel's policy and conduct, to engage in public debate and discourse, and to influence the debate within Israel, to challenge it, to point out problematic and dangerous aspects of the debate and the public discourse in Israel, and their potential to encourage violations of human rights, and also to lead and reinforce counter arguments using multiple tools and measures, whether international, local advocacy in the Knesset, public campaigns, etc. And the other direction is to support, to reinforce, and to complement the efforts of Palestinian human rights organizations, and they're doing a lot of good work and efforts overseas and within the international community to pressure and to mobilize different agencies such as the UN and the EU to take action and to force Israel to fulfill its legal and moral obligations toward the Palestinians, including the protection of their right to health as an occupying power.
Great. Thank you for that. Yara, a bit of a maybe provocative question, I don't know, for you. So how do you think Palestinians would feel about, so we're asking Israel to do more, right? That seems like the baseline. What does that mean? Do we want Israel to run a vaccination drive in the West Bank through the military? Do we want Israel to help secure vaccines and let the PA run it through their own broken, fragmented healthcare system? So what is the ask, and how do you think Palestinians would feel about that? What does that look like in your mind?
Yeah, so this is a really interesting question, because when I first started speaking and writing about this, that's the question I would get. So what, you want the IDF just running around the West Bank, and Gaza vaccinating people? And I think there is a really big continuum between do nothing and have your soldiers running around the territory vaccinating. The PA, which did assume responsibility for routine vaccinations, if you look at vaccination rates in the Middle East, the Palestinian territories actually are great. They are very high. Almost all children receive routine vaccinations. It's a pretty successful system. So I think there's got to be several asks, temporally speaking. The initial immediate ask is distribute vaccines to Palestinian public health facilities, private facilities, pharmacies, schools, just like we're doing here in the US. All of us are getting, people are getting vaccinated at sports arenas and gyms and anywhere where you can get medical personnel to do that. Israel does not need to deploy anyone. The medical personnel is there. If the Palestinian healthcare workers can receive their vaccines and they can be ensured some level of protection, I think they can more than handle the vaccination effort. Will it be totally smooth? Will it be super efficient and fast? I don't know about that, but certainly then we can criticize the PA and how they're handling the rollout, but they don't have the resources to do that at the moment. So I think the ask right now is for Israel to provide the vaccines to the Palestinian Ministry of Health, allow them to do the job that they've been doing for 30 years and vaccinate their people. But then the long-term ask is, what about the next crisis? What about the next pandemic? What about the next war in Gaza? What about the next, climate change or any number of crises that are coming? I really hope that this has shown us that this is not a sustainable system. And who suffers, while we have these abstract talks about two states this and one state that and yada yada, it's the Palestinians on the ground. I have, my family lives there. They want vaccines. They don't care how you get them. Life is very hard right now. They can't see each other. Family is very important to Palestinians. You can't have a wedding. You can't have a funeral. The economy is absolutely, there's no adjective to adequately describe how poorly things are going right now. So we need to save these complex political debates for when emergency and urgency is not of the question. Now is not the time to say, okay, well, let's figure out if the PA is really this, that, or the other state, and then we can vaccinate Palestinians. This is happening. We're a year in. Israel is almost reaching herd immunity. I don't understand why we can't do both. I don't think it's yes and. It's vaccinate today and discuss how we can decolonize, find sovereignty, reach a liberated Palestinian state in the future. And then, hey, I'm happy to do endless webinars criticizing the PA all day long. But right now, it's simply so much is out of their hands. Israel has a significant role to play.
Great. And I think you maybe have answered this question, but I do want to invite you to elaborate if you want. If not, Ghada, we can go straight to you. But it's this, what seems like perennial conundrum about how Israel treats Palestinians, wanting to sideline them just as a humanitarian issue and divorce that from the political context. So does that worry you at all with how we're talking about COVID and vaccinations for Palestinians in the West Bank and Gaza and even East Jerusalem? How do you approach this humanitarian or political categorization, I guess, of the Palestinian issue in the Israeli mind?
So this is a complex topic, but for the sake of time, I'll try to keep my comments brief. This is, and I'm going to argue against what I just said, because it's easy to say right now there's a crisis. We need to put these really challenging questions on hold. And I think right now this is a unique, once in a lifetime, hopefully, crisis that we do need to deal with immediately. But if we continually put off the tough questions until there's no crisis, well, it's these tough questions that are causing the crisis. So we will be waiting forever if we're waiting for some sort of acceptable status quo before we can move on to what happens to Jerusalem, what happens to refugees, what are the borders, these kind of core issues. We don't want more efficient dependence on humanitarian agencies. We want less dependence, period. That is the long game here. We want autonomy. You can't functionally run anything resembling a sovereign country without it. And those are ultimately political challenges. None of this is possible under the stranglehold of the occupation. You can't tell a child from Gaza that needs urgent cancer care today that that child needs to wait until there's a decolonization framework or until there's a formal two-state solution for that to happen. So for me today, looking at the COVID numbers coming out of Palestine, my initial thought is this is a humanitarian mission right now. And in those kinds of urgent situations, you accept help when you're offered. We try to use whatever political tools we have, but Palestinians need vaccines. They need them now. However, this humanitarian trap that you point out is really potent. And in fact, humanitarian agencies have almost entirely taken the burden off of Israel to fulfill its duties long before this. In many cases, Israel actually actively demolishes clinics and schools and facilities that the EU or some USAID has paid to build to meet Palestinian needs. So Israel is not just not fulfilling its responsibility, it's being subsidized by these external humanitarian agencies and is in some cases actually actively destroying them. So at the end of the day, Palestinians, are human beings that need care, but we also need a longer term project to force accountability, not just on Israel, but around the structures around it, including the UN, including the actions of the US that defend Israel's actions, no matter what they are, even when these actions go against these entities' own stated goals. So you won't find many countries who don't, in words, condemn the settlement project, for example, but when new settlements are built, nothing is done. So how do we prevent Palestinian suffering today while fighting against the political currents brought by Israel, by all third parties, and in many cases, even the PA? I think this is a struggle for all of us watching, participating, for Palestinians, and for Israelis who see this as a problem.
Thank you. That is very powerful. Ghada, I want to come to you to close. We have about 5 minutes left. And I want to come to you with kind of a bigger question than just Israel-Palestine. But, Palestine, of course, is not the only place where authorities are struggling to get COVID under control and find access to vaccines. That's the story across, impoverished countries and countries that can't pay the same prices that Israel and the United States can pay to buy these vaccines. And so while Israel, of course, has a special circumstance in that it's, rejecting its legal duties to vaccinate Palestinians, it's certainly not the only country that is totally rejecting its moral responsibility to do more. So can you talk to us about global equity for vaccines and what the broader trends in vaccine distribution that we should be watching and caring about and advocating for?
Yeah, totally. I think that Israel is not the only, example for a country racing to buy vaccines. I think the US is also another good example for this. Other European countries, as Yara mentioned before. And I think that the pandemic has, although I think many of us wish that this won't be, the reality, and what happened on the ground, but the pandemic did, demonstrate again that countries, especially rich countries, are not acting in solidarity and global responsibility, but rather taking selfish steps, as I said, by racing for securing vaccines to their own population. And I think that we are witnessing, national vaccination in many countries. And, some countries such as Israel are even purchasing more vaccines than they need, using them to political bargaining and diplomacy. And we've heard about Israel's intention to send vaccines to countries to support them politically. This makes vaccines inaccessible to people in, poor countries and poor income countries, but not only poor income countries. However, I think we do understand today that the pandemic is global. It's a global issue, a global challenge, and the solution and the response as well should be and must be a global effort. Now, although I avoid using utilitarian arguments, especially with the Palestinian topic, although I do agree with Yara's latest answer for your question. And I wish that countries, were providing assistance out of solidarity and moral and global responsibility, but countries are not doing this. So what about the, advisable economical and, public health perspective that, says that if the pandemic is not controlled in, one region, it can spread, and the virus can mutate and make the vaccines less effective. And I don't know if you are, familiar with the Rand Foundation that stated that an equal allocation of vaccines could cost the global economy trillions a year, bringing even strong economies into a deep crisis. I think that if the pandemic continues, I'm afraid that we will see more human rights violations by governments and more political instability. And I think that Israel, again, not only leading medical apartheid and denying vaccines for population based on their nationality and race, but also has been, exploiting the pandemic for surveillance and, by security services. So just to end, I think that countries should, work for a global solution. And I think that distributing vaccines in all countries according to, at-risk groups, for example, all the elderly in all countries or all the health workers in all countries, maybe should be the solution.
So much more we could dig into. I'm sad we're out of time today, but I want to thank you both so much. I want to thank everyone who showed up to this webinar, and especially those who submitted questions. I'm sorry we didn't get to all of them, but we always share your questions with our panelists so they know what people are interested in. We will post a recording of this webinar along with all of the resources that we shared today on the FMEP website, fmep.org. It should be up later today. If you registered for this email, you'll also receive an email with a link to the recording and all of the resources. Please check back at the FMEP website for future webinars and other events. We have a whole list of publications you can sign up to receive. And again, we thank you so much and we hope to see you soon. Thank you so much, Ghada and Yara.
Thanks for having us.
Thank you.